The meniscus is a very important structure in the knee. It's a cushion made of cartilage between the femur and the tibia. Symptoms of a meniscal tear may include pain, swelling, locking, or buckling of the knee. Patients sometimes require what's called a partial meniscectomy, where a part of the meniscus is removed to reduce the pain and to provide normal function. The rehab for a partial meniscectomy I like to divide into 3 phases. The first phase is the acute phase, and the main goals in this phase are to reduce swelling, to increase the range of motion of the knee, and to restore normal gait. Now, I like to employ 3 main things to reduce swelling. We can do retrograde massage, we can do electrical stimulation, and the third one is ice. Range of motion includes 3 parts. The first part is passive range of motion. The therapist will move the patient's knee. The second part is called active assistive range of motion. The patient herself will move her knee with the assistance of her other leg, or she could also use her hands to try to bend her own knee. The last part is called active range of motion, and during this part, the patient herself will just bend the knee without the use of any assistance from her other limbs or without the therapist's assistance. The second phase is the restorative phase, and the main goals in this phase are to restore the patient's normal strength and their normal function. The main techniques in the restorative phase are strengthening exercises specific to the weak muscles that they may have in their knees, primarily the quadriceps or the hamstrings, and also getting them to kind of move around normally, getting in and out of a chair. The last phase is called the athletic phase, and the main goals in this phase are to restore agility, coordination, and power. And this is employed on patients that are more athletic and want to return to a specific sport. The balance board is important in restoring coordination, agility, and core strength. Another technique to improve agility is sidestepping. The time to complete this rehab can be anywhere from 4 weeks to 3 months. At the end of the rehab, a patient could expect to return to full function. They could return to their sport, they could return to their activities of daily living, and they expect to be back to normal.